The Vice President, Professor Yemi Osinbajo, has thrown his weight behind the idea of the introduction of mandatory health insurance in Nigeria. This position has been consistently canvassed by the Executive Secretary of the National Health Insurance Scheme (NHIS), Professor Mohammed Nasiru Sambo, at various fora. Professor Osinbajo made this call during the Primary Healthcare PHC Summit in Abuja. The Vice President, who declared the two-day summit open, held from March 24 to 25, 2022 at the International Conference Center (ICC), stated that mandatory health insurance held the key to unlocking an efficient healthcare delivery system in Nigeria, adding that government alone was unable to adequately fund healthcare for all her citizens.
Permit me just three trends of thought very quickly as we reimagine primary healthcare in Nigeria. The first, of course, is dealing with out-of-pocket expenses. And I think we clearly need compulsory health insurance, where premiums for certain categories of vulnerable groups are paid by government. And the Honourable Minister of Finance has already said that our target is 100% coverage of the poor and vulnerable in the short to medium term. There is no way that healthcare funding can be paid by government budgets alone. It's simply impossible. The size of the federal government budget itself is so constrained, and there is absolutely no way that we can expect to fund healthcare by just budgets. And so healthcare insurance is an important pool of resources for funding healthcare on the scale that will be required for a country of 200 million people or more.
The summit, which drew partnership across various spectra of healthcare system, including the National Health Insurance Scheme (NHIS), under the theme Reimagining Primary Healthcare in Nigeria, saw several key political figures lending their support to compulsory health insurance. The Minister of Finance, Hajia Zainab Ahmed, during her most useful presentation, stressed that compulsory health insurance will ensure sustainable funding for the healthcare sector.
There's also increased allocation to health insurance. And our target, of course, is to provide 100% coverage for the vulnerable within our society in the short to medium term basis.
For his part, the Minister of Health, Dr. Osage Ehanire, said that health insurance remained the most viable option to healthcare financing.
To achieve UHC and SDG targets, PHC funding has to expand to reduce out-of-pocket costs for healthcare to less than 30%.
Speaking on the sidelines of the summit, the Executive Secretary of the National Health Insurance Scheme, Professor M.N. Sambo, who was one of the guest panelists, stated that making health insurance mandatory was the way to go, adding that it was the reason speakers at the occasion spoke in favor of the idea.
That is the path to go. Any delay in getting mandatory social health insurance is delay in achieving universal health care coverage. And you know that by 2030 we're supposed to finalize the journey. So delay is not helping anybody. That's why the Vice President mentioned it, the Minister of Finance mentioned it, and all the speakers, you even listen to the Senate, Chairman Senate Committee on Health today, he has mentioned it, and all the efforts that we are doing to ensure that the mandatory law is signed.
The National Health Insurance Scheme law is currently undergoing legislative work to make health insurance in Nigeria mandatory.